Do you recommend eating the new popular vegan burgers that are made from a variety of pea and similar proteins?
Oh my, well, I've been in the plant-based health world now since 1981, and when I first became vegan and got into health food eating, there were these veggie burgers, and they were just dismal. They were just kind of oatmeal patties that it fell apart in your hands and on your mouth, and well, they were kind of amusing things I never really put much stock into. Now, the Boca burgers were a bit of an improvement back in the 90s, but we've all been amazed and somewhat impressed as science marches on. And those brilliant folks, the foods technologists at Impossible Foods and Beyond Beef, came up with these remarkable burgers that, for all the world, have the taste and texture of a really meaty beef burger. And they're quite tasty. They're delicious. So, and as much as that, oh boy, it brought me back lots of great memories. The first time I had a Impossible Burger, I had to stop back and say, "Okay, doctor, is this really a healthy thing to do?" And and you can make arguments that it's a processed food. It's full. Some of them have a lot of salt. Some have oils in them. Yes, yes, yes. That's true. And for that reason, I can't call it a health food per se. And I sure don't advocate, the dose makes the poison. If you're going to have one, once a month as a treat, okay, but to remind you what it used to be like, they have one of those burgers, and you don't want to be eating them 4 times a week there. So if that's the case, do they have any use? You bet. I am so grateful because they're such a great ambassador, a great transition food for Joe meat and potato guy. So I've got to have my meat. But they bite into one of these burgers and, oh boy, I could eat that. Oh, that's not bad at all. Man, you've changed that man's life with one bite of one of these burgers. And again, he shouldn't be eating 5 of them a week. He should have, one a week, once every 2 weeks. But if it as a transition food, it takes people who are so scared of a plant-based diet, takes them by, hey, you can still have taste, still have texture and enjoyment, takes them by the hands. Oh, okay, I think I could do this. If for that role alone, because it takes the strangeness and the repelling that people, plant-based, now I need my meat. It helps them overcome that. I'm so grateful for these products. And so I will approve them for my new in transition patients, but it's also with the caveat, listen, you don't want to eat these things every day. They're a treat food. Have them once a month, twice a month. That's about it. And if you do that, and they're part of the transition program for these patients, I'm very grateful that they exist, and they do have a limited but an important role to play.
Do you recommend people get colonoscopies? Do they save lives?
Oh my. There was a time I would say, yeah, everybody needs colonoscopy. But there are some realities involved. One is, it's expensive, it's uncomfortable, and it's not without risk. You do colonoscopy. This is taking an 8-foot flexible tube and sliding it up the rectum and then up, over, and down the entire length of the colon. You do that with enough people, do 1,000, 2,000, you're going to, cause some bleeding, you'll cause a perforation. It's odds approach certainty that a problem can arise. For what? Not to say that the procedure has no value at all. And if someone's had, say, signs of an obstruction, you get an MRI or a CT, and it looks like they got a mass in the lower right side, in their ascending colon, just by the cecum. You bet, man, they need that colonoscopy snake put all the way up there and all the way down and get a biopsy. It has an absolute use. I'm not saying there's no use for it. But we're talking about it as a screening procedure here. Should you be doing this on thousands of millions of men and women? Should you be doing this? Well, then you got to start being a doctor. Say, well, who is this person? And one, what's their family history and what's their dietary history? If you got a 40-year-old guy with some blood in his stool, and you ask him, yeah, my father, 2 brothers, and an uncle all died of colon cancer at age 45. yeah, this man should probably have a colonoscopy done. Absolutely. And probably one every couple of years, after that. And especially, oh yeah, man, I love my red meat. I eat it. I eat something, some meat 2, 3 times a day. He should have a colonoscopy. The flip side of that, you got a 70-year-old guy who's been vegan for 40 years. No, nobody in my family has ever had colon cancer, not even close. Been eating plant-based for 40 years. I had a colonoscopy once 10 years ago, clean as a whistle. Does this man need another one? The odds of him having sprouted out of colon cancer in the last 10 years are tiny. So you got to just look at who are you talking to, doctor? Who really needs it? The folks at high risk, yes, there's a place for it, and you need to talk to your gastroenterologist and decide the screening. Now, if they do the colonoscopy and they find a bunch of polyps, these are early precancerous lesions from the cancer-causing chemicals in the food rubbing on the colon wall, and you're starting to sprout out an early tumor that will turn into a cancer. If they find a couple of polyps, this man needs repeat colonoscopies every couple of years. If it's clean as a whistle, and there's no polyps, and he's a plant-based guy, even if he's got a family history, do another one in 3 years. If that one's clear again, I would say this man could just do. Now they have these Cologuard tests that look for DNA of cancer in the stool. I'd say, man, follow this guy along with you. And if people do have a polyp that's starting to go malignant, and that polyp will ooze a little blood into the stool mass. You won't see it. It's occult blood, but you can check the stool for occult blood. And I think you could just ride along with checking the stool for occult blood and maybe sending off a Cologuard every 2 years or so. And the plant-based eater with no family history, I think he could ride along with that. So it depends on the person, their history, their diet. And be aware also that there's a much less invasive procedure called a flexible sigmoidoscopy. The sigmoid colon is in the first 24 inches of the intestine, and about 80% of the colon. And about 80% of cancers are in that last 2 feet of colon. So if there's any bleeding or whatever, I will have the doctor slide up a flexible sigmoidoscope there, have that done, and you probably can identify the bleeding source or the pathology without doing the whole full colonoscopy. So there's a little wiggle room there, so to speak. But by and large, it depends on the patient's family history and their diet and their age, who they really are. So it's got to be decided individually. But by and large, does every man need a colonoscopy every 2 years? No, they don't. It depends who they are, what they're eating.